thank you for being here and listening to all the experiences. The reason I wanted to talk about is because while we are having a meeting here, we received a message from a Spanish speaker family asking us for help. The daughter came 2 days ago after being with friends that she wants to commit suicide. So I apologize if I was disruptive. But again, talking about systems, we didn't talk about immigrants. I want to just point out there that we have our emergency systems, but we don't have mental health providers that speak Spanish.
Yeah.
We do have, but we have very limited providers. So while we're speaking here, we don't know what's going on out there. But who is responsible? So I work on a community-based resource center and also in community engagement. Is the Mirabas and the neighborhood navigator. We listen a lot of trauma. We try to support the residents in social, emotional, and determinants of health. Try to do our best, but the capacity we have in Eagle County is very limited, and not only on bilingual, bicultural providers, but also caseworkers or people that work on the ground to address all these issues. To me, it's easy to recognize what mental health challenges Hispanic family has, but we do a lot of work on making awareness on the cultural piece and how can organizations support, which being an immigrant, you go through a lot of steps to get your residency. So you go through every state of from anxiety, depression, and long-term could go into other diagnoses. The acculturization, which just coming with the culture, we have mainly first generation Spanish speakers in this valley. So parents try to learn how to live in this valley, while children are learning two cultures and trying to fit into the second culture. So there are a lot of challenges on mental health there as well. Another thing is racism and our ethnicity, how we behave out there, and then how we are perceived. And that also bring a lot of mental health challenges, and trying to, grow as a professional, as a parent. I can go on and mental health challenges for immigrants, but my concern mostly is like when I have this call, these messages, this conversation with other people. I say we because there are many people involved in the work that I do. We really are lost. We start with what we have, and then going down the list. We have in one hand, we have the options of what do we do, maybe in 3 fingers, on providers or just sending somebody to their home, or what is it that we can do, which I think is not, it's an equity thing as well. So I don't have answers. I just need answers.
Yeah.
But I just hope that from this group we can just talk about how can we better support the immigrants, not only Spanish speakers, but mainly Spanish speakers. Yeah.
Thank you.
Thank you.